So we have a few empty seats. If you can find one, you can have a seat. Again, we have cards in the back that have a spot for writing a question, and drop them in the basket, and they'll be submitted for the question and answer period. Good evening. My name is Eric Sund. I'm the Assistant City Manager for the City of San Clemente. I'm honored to host Congressman Darrell Issa on his town hall meeting tonight. So with that, I'd like to introduce Congressman Issa and have a little introduction, please.
Now, I know that my role here is first of all to have you hear from the panel, and second of all to take your questions. So that's going to be the majority of tonight. I'm going to speak for no more than 5 minutes. You're going to cut me off if I get beyond 5 minutes, because I want to ask our panelists all to do the same, and then we want to take your questions. This evening, though, is about a crisis that's building not just in South Orange County, but around the country. We have two crises, and I just want to make sure I recognize both of them tonight. We have a drug and alcohol problem in this country, and we have literally millions of people who are in need of help. So that problem's not going away. We also have thousands of organizations around the country who have dedicated themselves, both profit and nonprofit, to helping have people learn to be dry and sober. That's a good thing. We also have a number of laws that were intended to protect the disabled, intended to protect against discrimination. And those laws are well meant, and they're not going to change drastically. But it's very clear that there is a possibility of abuse in many of our neighborhoods, and that abuse is one that we want to have cities be able to have reasonable local control to determine what should be in their neighborhood in the sense of volume, in the sense of facilities and capability. That's not a hard thing for us to understand in America. So tonight's listening session is respectfully going to recognize we do have a drug and alcohol crisis in this country. We will have millions of people in need of help. We will have people who need accommodation, and we will have organizations who are dedicated to reach out and help those people. And all of that is what we're going to review while finding where small changes could empower cities, the state, and around the nation to realize that we need to make sure that these, thank you, that in fact we do just what I said. Recognize the problem, find organizations that want to help with it, empower them, but also protect our neighborhoods. It's that simple. We do have draft legislation, but I make it very clear. It's draft legislation because we want to make sure we get it right. We empower the states and the cities, and at the same time, protect those that these laws were meant to protect. They're good laws. We want to make sure that they work for Americans without harming our neighborhoods. It's that simple, and I thank you, and hopefully I am within my 5 minutes.
If you'd like to do it there, come up, whatever you'd like.
Can you all hear me well enough? Great. Well, I want to thank you for having this tonight, Congressman Issa. For myself and my colleague, who's probably having trouble finding a parking place, Assemblyman Bill Bro, I think this is about our 5th or 6th town hall. So it's really important for the people who have come to those to participate in the important forum that we're having here tonight, and we have had on the issues surrounding the rise of sober living homes and treatment facilities in our residential communities. Both Bill and I, along with our colleagues in the state, we've been working on legislative solutions since we arrived in Sacramento early 2015. We certainly have seen and we've heard from all of you for the need for legitimate, well-run facilities in appropriate places in appropriate numbers to serve the people who are making what we consider to be a very courageous effort to get clean. And as you know, you just heard from the congressman, they are considered disabled. They are a protected class. So current state and federal laws provide them the opportunity to stay in typical households and typical neighborhoods, to re-enter and integrate with the larger drug-free community. That's part of their rehabilitation. However, we've seen that at the end of the day, for sober living and residential treatment uses to work as they are intended, they must not change the character of our neighborhoods. If there are too many, are they too close to each other? Are they too large, too many people in one dwelling unit? Those uses make it feel and act like not a typical household, but what? The other side of this issue is that the unrestricted promotion of sober living and residential treatment threatens the character of the neighborhood. They begin to seem what? And I think we've all seen that, institutional. Not institutional just for us in our neighborhoods, but certainly the residents in recovery. They're supposed to be in just a normal household family situation, and yet with the proliferation and the numbers they are putting in some of the homes, they are becoming institutionalized. That, by the way, was pointed out, I believe, in the Costa Mesa City's lawsuit and upheld by the judge, that you can't change, you shouldn't change the character of a neighborhood by institutionalizing certain uses within it. These sometimes result, as we know, in frequent nuisances such as excessive noise, smoke, trash, traffic, and parking. There are reports of increased drug activity around some of the facilities. That does not help our recovering folks. Vandalization, trespassing, violations of privacy of neighborhood residents. And as you know, there's been reports within the home, several untrained, those who are not really capable of taking care of people who are in recovery, in phases of the recovery. So what's that resulted in? Harm. We've even seen deaths, and I think you've all read about some of those and heard the tragic stories from loved ones, parents. We hear all sides. We hear from the residents in recovery trying to get clean, who want to do it right and re-enter the broader community, and certainly we've heard those tragic stories from parents and other loved ones who are worried about what kind of care is my child receiving, and they are paying high prices to ensure that their kids are getting the kind of treatment. We hear from the neighbors who feel that their neighborhoods have changed in character, and we all know that that seems to be the core issue here. As I said, Bill and I have been working on solving the problems with legislation in Sacramento. We've had over the 20 years, there have been more than 25 pieces of legislation introduced. None have been successful because we still have this yin and yang with federal law. The proposals that we proposed could have made things better. Bill had one. I don't think yours got out of committee. Mine got to committee, but yeah, it didn't make it to the other side. But we're not, we're not finished. We understand that, with the help of federal legislation, and we're really supportive of what Congressman Issa is doing. I don't know if you're going to chat about your legislation, but it's really a step in the right direction because it will give your local governments and your communities. We have CC&Rs that people are, frustrated over. The tools that are in the Congressman's legislation will really help us define and navigate a very, very complicated path to ensure that those who are operating as unlicensed group homes, somewhat different, by the way, than a licensed sober living home. 6 or less are mandated in those. They can't go over 6 when they have a license, because guess what? They're giving treatment. But when they are group homes, and that's basically what we see, they're unlicensed, we need to have some regulation on them. So we're happy to support that legislation, and I don't know if Bill wants to chat a little bit about some of the avenues we've tried, but we're not here to give up. We're here to take more input, hear from all of you, and know that if we work together at the state, the federal, and the local level, and there's some success stories at the local level you hear about, we will make this right for both sides of this issue and ensure that our neighborhoods are protected, and certainly those people who may be some of your loved ones are given the right kind of care to help them on the path to recovery. So thank you.
Thank you, Senator. So I'd like to introduce Assemblyman Bill Breaux.
Thank you very much. First, I want to thank all of you for coming out tonight and taking charge of your community and the issues that are facing us as a region. It's just not South Orange County. This is talking to my colleagues. This is in Big Bear. This is in Santa Monica. This is really a statewide issue. And I just want to thank you for being involved in the solution and helping us craft a solution that is right for our communities. This is probably our 4th or 5th forum, 6th forum we've done. And I always tell the story that I first learned out about sober living homes in 2008. And there was a home on our street that ended up in foreclosure. and the gentleman weaned out the end of the foreclosure for a year until he had to vacate the home, but he turned it into a sober living home. And everybody on the street was confused who the tenants were, the vans that were coming in and out. I actually saw a marijuana deal right in front of my house. A car pulled up and one of the tenants passed cash and got marijuana right in front of my home. So it goes back to 2008 for me. And like I said, when we got up to Sacramento, it was my first term. It's one of the first bills I introduced because I knew it was such a big issue in our community. And as Senator Bates said, you know, we believe in recovery, but there's right ways to do it. And doing it in a neighborhood, I don't believe is the best for our neighborhood, or frankly, the best for the patient. And over the last 20 years, as she mentioned, there's been 30 attempts. Even basic things like trying to count the number of them in a community so we can get any kind of data. Counting them and putting the number on a website, that bill failed. Every attempt has failed. I've got some stats here from the Mayo Clinic. You know, their studies show that 80% of alcoholics will relapse within the first year. The National Institute of Drug Abuse says 40 to 60% of drug addicts will relapse from their plan of treatment. And as I mentioned, there's appropriate places for treatment, but we can't even find out if the patients are being treated, or if there's recidivism, or if these places are even working, because we can't even get information on them. I mean, you've seen the stories in my home at Dana Point. We've had overdoses in these things. So we don't even know if and there's a lot of money involved. Parents are using their life savings to try to get their children off of drugs and alcohol. And I think we need to make sure that those services are working for them. And it's not too much to ask, because there are good actors. There are good actors that are regulated, and they're professional treatment programs. But sometimes it looks like these sober living homes, you know, trying to skirt the law. And it seems like some of them are in it for the money. So we're trying to craft an approach where these sober living homes move under the regulated side of treatment and addiction. So again, as Senator Bates said, we're not done. This is just the beginning. We've had a lot of collaboration with the League of Cities. My colleague from Santa Monica, Richard Bloom, was a leader in carrying a piece of legislation. We had a lot of bills this year, and we just need to keep making the case on why this doesn't work in residential neighborhoods. And I really want to thank Congressman Issa, because over the last 2 years of talking to Costa Mesa, who's on the front line, talking with every other city, it always came up to, well, we've got ADA and we've got fair housing. So I remember last year I called up Congressman Issa, and he talked out loud about his ideas, and he was very proactive. And now he's back home, not in Washington. He has a chance to have a town hall like this. I want to thank him for doing that and for his leadership. And he introduced a bill to try to help us at the federal level. So thank you for having me.
Thank you, Assemblyman Bilbro. Now San Clemente City Councilman Tim Brown.
So good evening. It's wonderful to see you all. How's that? Is that better? Okay, here we go. All right. There we go. Good evening. It's wonderful to see all you folks here tonight. Just from a show of hands, how many of the folks here are residents of San Clemente, if you wouldn't mind? So we have strong representation. It's good to see you all out here today. First of all, I'd like to acknowledge, I saw a colleague here, Mayor Pro Tem Kathy Ward is here. Chris Ham, Councilman Chris Ham wanted to be here, but he is currently, he's a firefighter in our community, and he's working tonight. And then Mayor Baker should be arriving shortly. He had no CFA board meeting tonight, so he was coming down. And I didn't see Councilwoman Donchek. I'd like to recognize her if she's here. Anyway, I wanted to address a few things that, particularly about this issue, which has been a very hot button issue for our community. When I was elected 6 years ago, the first call I got from a resident was about a sober living home that was in their neighborhood and was complaining about the impacts. And of course, I thought that we had tools to address this, so I went immediately to our city attorney and started asking questions, and found out that we really lacked those tools. And we didn't have much that we could do to address those problems. And so about every quarter over that same period of time when I was in council, we would receive these complaints and the same response would be given every time. About 24 months ago is when the complaints started to escalate, and at that time we had what I would characterize as an explosion of these types of homes, this type of use in our community. And it was something that was becoming so profoundly difficult for our residents that the council decided to impose a moratorium. And that moratorium was enacted, I believe, in July of last year. And the moratorium effectively was initiated because we didn't have the tools to regulate the impacts of these sober living homes and unlicensed and large licensed recovery treatment facilities in our neighborhoods. So the purpose of that moratorium was so that we could study these effects and figure out what to do. Because we just didn't, we had an inadequate set of tools to be able to address the problem. While we were doing this investigation, we noticed that some of these the uses that were so troubling are characteristic of broader uses that we needed to better regulate and integrate. And this included transitory lodging uses which began to proliferate throughout our residential neighborhoods, Airbnb and VRBOs. And so during this moratorium, we worked to develop the ordinance and new regulations that allow for these uses in appropriate ways and appropriate manners, but would also give us a regulatory toolbox that we could use to address those in the neighborhoods and then also find the best places for that use and the regulations behind that. The result was we came up with a series of regulations that we recently adopted. We created a new boarding house category, residential use that involves a dwelling unit of 2 or more short-term rentals or 4 or more long-term rentals. We created a new STLU ordinance zoning definition. We also renamed the previous STLU permit and then created an operating license. And most importantly, we have a whole series of increased enforcement capabilities with that. And we our code enforcement staff has become very expert in navigating these things. And lastly, we specified the types of commercial operations that are permitted in residential zone properties. The summary of those regulations, in short, is that we created a new boarding house use category. And any residential use that involves a dwelling unit with 2 or more short-term rentals or 4 or more long-term rentals, we treat all group living homes the same to avoid any discrimination. This includes homes that serve vacationers, home occupation, or those seeking rehabilitation from drug addiction. And then lastly, we established a discretionary permit for boarding houses, limiting these to higher density zones and requiring a 300-foot separation between those. Since then, we've conducted outreach to try and get a better understanding of the community of these regulatory uses, and it's new, and we're learning more about it every day. On a personal note, when we were dealing with these impacts, I also personally saw the impact of a sober living home on our neighborhood, which happened in my neighborhood. As a matter of fact, I see some neighbors here tonight who also live there at the same time. Now, it would be great if these homes didn't have impacts on the neighborhood, but it did. In an 18-month period of time, we had 2 overdoses and a stabbing. And we were happy enough to see a gurney being wheeled out, from the coroner's office when I'm driving my kids home from school. So this is a horror story involved with an irresponsible use and something that we hope that with this regulatory toolbox, with the controls we put in place, that we can address on a local level. However, we are extremely supportive of our state representatives and our congressional representatives taking more proactive measures on other levels, because we know that this is not done only locally. We need help, and we need help to be able to address this on a wider level, on a larger basis, and frankly, to help us to be able to answer what is a very challenging question. And so I'm deeply grateful for all the passionate residents who spoke up during this time, who have really helped us to understand the issue, and have been patient as we've tried to work through this. Is it perfect? I don't think so, but we did the best we could with the tools we had, and I think we can address this issue on point. So I'm very excited about the opportunity to be here tonight. I think that we'll be able to increase understanding on both sides of this, but most importantly as a city, that we'll be able to really be on the forefront of addressing these concerns, and not instead of being reacting constantly to it, that we're trying to be more proactive in our approach on these issues. So really grateful for this opportunity.
Thank you, Councilmember. Todd Leishman, attorney at law.
Thank you. My name is Todd Leishman, as noted, and I work with the city attorney team for San Clemente, as well as a number of other Orange County cities. In fact, I work on this issue locally, throughout Orange County, and as far away as Big Bear Lake and the high desert. So it's good to be here and to be talking about this. Just so that I know who I'm talking to, can you raise your hand just real quick if you are here from the community and you're here as a concerned resident? Just raise your hand. And thank you. And if you're an elected official, you guys on the stand should be raising your hand. Guys, hello. Good. So, and if you're here from the recovery industry, if you're either in a facility or you're running a facility or maybe you work at a lab. Yeah? Okay, good. I'm glad you're here. I'm glad that all three of you groups are here. This isn't going to work unless all three of you groups are here and talking and are part of the conversation going forward. A lot of times, you know, we only have 5 minutes each, so I wasn't really sure what to cover, but a lot of people ask, why is this such a thing now? Right? Why now? Why did it explode? And it's kind of twofold. Back in 2000, there was Prop 36, in California, which required mandatory diversion for a number of drug-related offenses into rehab. So that was built-in demand, at least from California. And then when the president enacted Obamacare, I don't remember the long official name, but that provided
Affordable Care Act.
Thank you. We should send him to Washington, D.C. He seems to know a lot. No, that's what provides the funding. I mean, that's what kind of opened up the funding. And so that's why we're seeing it expand so quickly, is there was built-in demand. There's demand from all over the state, or all over the 50 states. You'll notice that people come from all over the country to get clean here. So that's part of the demand. When it comes to local regulation, there are a number of constraints to navigate. I've worked closely with state and federal representative offices and local to navigate, to kind of deal with this at every level, and I gotta say, it's a tricky labyrinth. It really is, and the main reason why is because, think what you will, if you're in recovery, as a matter of law, you are disabled. The law views you as disabled if you're in recovery. And that makes sense to a lot of us that have known somebody who's trying to get through that. But the trick with that is that if you're in recovery, or if you're disabled, that's a protected class. So that automatically invokes state and federal protections for protected classes, right? And does that mean that it's impossible to regulate? Absolutely not. Does that mean that you have to be thoughtful and responsible about how you regulate? Absolutely. So on the state level, the biggest constraint is a section of the Health and Safety Code, which says that any facility that is trying to help people that are recovering from drug or alcohol addiction, any facility that's providing services to them, non-medical services, has to be licensed by the state. And you can understand why, right? The policy concern is we've got a vulnerable population of people in recovery. We want to make sure they're being well taken care of, and that the services and the recovery help is legitimate. So you have to get a license if you provide any non-medical service. And here's where the first big branch in the road goes between folks that are trying to regulate, and that includes the state, by the way, and folks that are being regulated. Most recovery facility operators say, take the position that I'm not doing counseling in the house, I'm not administering any drugs in the house, I'm not providing any services. We don't do that here. We put them in the vans, we drive them down the street, and we do that off-site. All they do is live here. But that's not the language of the state statute. The state statute says any non-medical service, and granted it's a vague definition, but it's really broad. It includes any kind of planning, any kind of med dispensing, any kind of control over their schedule. basically, if it's anything more than a resident-run, roommate kind of situation, you're in that land you're in that arena that needs to be licensed by the state. So there's this big disconnect between operators that say, we don't need a license, we're not doing those three things, and the statute itself and the cities that are saying, wait a second, you provide non-medical services to these people. You need to be supervised and regulated by the state. So that's the first branch. The state law says that if you have one of those state licenses, and you're in good standing, and your license is capped at 6 or fewer people, then the cities have to treat you the same as a family residence for purposes of business regulation and zoning. Oh, I'm over my time. But that's a very narrow protection. That's a very narrow protection. If you have a state license for 6 and fewer, it's hands-off. If you don't have a license, it's not hands-off. If you have a license for more than 6, it's not hands-off. If you have a license for 6 and fewer, and you're violating your license, I think it's still hands-off. Okay? You have to have the license for 6 and fewer and be abiding by it to be a legal use. Okay, and so that's it at the state level, in a nutshell. And on the federal level, as I think we're going to hear a little bit more from my colleague here, Peter, there's the ADA and the FHA. The ADA, the American with Disabilities Act, and maybe Congressman, you can correct me if I get that wrong, and the Fair Housing Act. And what those boil down to is that you can't, remember what we said about how if you're in recovery, you're disabled, and disabled is a protected class? So a city can't regulate against them any differently than it would other people on that basis, okay? So just like for race and religion, we couldn't tell somebody because of their skin, because of their race or because of their religion that they can't live in this neighborhood, and they can, okay? It's the same thing. You can't draw that line based on the disability, but they can ask for a reasonable. Well, anyways, I think that's probably all I need to say right now, and we'll hear more about the other stuff.
Thank you, Todd. Peter Pierce, attorney at law, please.
Good evening, ladies and gentlemen. I am a litigator and I represent public agencies all over California. In 2008, the city of Newport Beach overhauled its zoning regulations in terms of group homes and other similar uses. The following morning, 4 federal lawsuits ended up on my desk, 3 filed by sober living homes and 1 filed by a group of residents in Newport Beach. So I was sort of plunged into the odyssey of federal law, the Fair Housing Act and the ADA, as my colleague has alluded to, and how they apply to sober living homes. And what really surprised me, we won the case at the trial court level, then we ran into a brick wall at the Ninth Circuit. And what really surprised me is we often think of discrimination as treating one group of individuals differently from another group. And Newport Beach's ordinance did not do that. Most of ordinances don't. When you read the ordinances, they seem to treat groups equally. The federal judge who adjudicated the Newport Beach case and the Costa Mesa case actually remarked that it appeared that on its face, the ordinance actually treated sober living homes more favorably than other similar group uses, which might make some sense because individuals, as we heard, who are in recovery from alcoholism or drug addiction are protected. But there's a different kind of discrimination that courts look to. And by that, I mean they look to all sorts of things that at the time they're occurring, you don't think they're discriminatory. For example, when residents or the good citizens of a community come to public comment period and complain about sober living homes. Or you might have an elected official who makes a comment about a sober living home. Under the law as it now exists, and as the Supreme Court interprets it, courts can use those comments as a basis to conclude that any regulation that is adopted after those comments are made is discriminatory. And that's kind of counterintuitive. But that's the regulatory landscape and the legal landscape that local and state elected officials are dealing with, and why it is important to try and make changes in the law, because the law is really stacked against regulators who are trying to just make sure their communities, everyone in their communities, are treated equally. Some communities that I have represented have formed task forces to try and figure out what to do about clustering of sober living homes in particular neighborhoods. There are some cases that say the very act of forming a task force is itself an indication of discrimination. This is sort of how far the case law has gone, and I hear a lot of mumbling in the audience about that. But the case law is that extreme, at least in the Ninth Circuit, so it's sort of very difficult. The DOJ and the Department of Justice and Department of Housing and Urban Development have issued some loose guidelines about the clustering of sober living homes in communities. And those guidelines sort of say, well, if they reach a critical mass and start to institutionalize a neighborhood, then under those circumstances, maybe you can impose distancing requirements. But those guidelines don't really have any teeth. There's no definition that you can really look to know if what you're doing is going to be judged legal or illegal, or if the United States is going to file a lawsuit against your city because of what you've done, or if they approve of what you've done. I recently was on a panel with a lawyer from the Department of Justice talking about sober living homes, and I actually asked her about this, and she said she didn't know what it meant. And that's kind of, you're sort of looking at sort of this nebulous body of federal law, and it's not very clear. And so hopefully some clarity can be brought to that by your elected officials, and I think that's why it's so important that they're engaging in these endeavors, because the law is quite unclear, and it's very easy to be a local elected official, act in the very best of faith, and have the courts pull the rug out from under you because of the state of the law.
Thank you. Tony Cardenas, Public Affairs Regional Manager, League of California Cities.
Yes, good evening. I'm Tony with the League of Cities. I'd like to thank the City of San Clemente and Congressman Issa for this invitation to speak tonight. The League, we're a nonpartisan, nonprofit advocacy group for cities across the state in Sacramento. And our organization has had a long history with this issue, supporting legislation that gives cities more authority over the time, place, and manner of sober living homes. The most recent example was just this year, and that took under the form of a bill, AB 2403, where the League of Cities, we actually sponsored this bill. We approached a Democratic author, Assemblymember Bloom, out of Santa Monica, as the primary author. We approached Assemblymember Bill Breaux, Republican, as the co-author. And from our experience, we see that the majority of sober living homes do operate as a business enterprise, and like any other business, they want to maximize profits. And what we've seen is multi-structure complexes, almost like a campus facility in a residential neighborhood. Clearly, the overconcentration of these facilities, it impacts the character of the neighborhood. So we've tried to author legislation to give cities more control. And what this bill would have done, it would have done two things. If a sober living home wants to open in a city or county, it would have required that sober living home to give the city or county a notice, because right now current law says there is no notice that should be given to cities or counties. So cities don't know when these facilities are popping up. The second thing that this bill would have done is it would have required a 300-foot, it only would have required one sober living home for every 300 feet. So essentially a 300-foot radius. Now keep in mind all other group homes for disabilities, they have this 300-foot radius. What this bill would have done, it would have codified law to the Fair Housing Act. So it would have done two simple things. The bill did get out of the first committee out of Assembly Health, which is a major victory, but it was killed in the Assembly Appropriations Committee. And it was, by killed, I mean it was voted down. And it was not during the day, it was in the middle of night with little testimony and little, no policy reasons as to why the bill was killed. But nonetheless, we're going to continue to try to support legislation that gives cities more tools. We also supported Senator Bates's bill, SB 1283, providing testimony and support. So I would like to thank Senator Bates and Assemblymember Breaux for their efforts. But even during Governor Schwarzenegger's days, the League of California Cities, we drafted an executive order because we believed the governor could act. And what I understand, this executive order was worth about 10 bills that would have brought us to some common sense ground. But even back then, it didn't go anywhere. We had every Republican in the Assembly and Senate sign a petition saying to support this executive order, but it didn't go anywhere. Nonetheless, what are we doing now? In addition to our legislative advocacy, well, the Orange County Division of the League of Cities, we hosted one of the very first forums this year on this topic, on sober living homes. It was for city officials, staff, public, to discuss what is the law, what works, what doesn't, what are cities doing that is currently working, what are actions that cities have taken that have resulted in lawsuits, where ultimately the taxpayers and residents are on the hook. As was already alluded to, Newport Beach, they thought they were doing the right thing. Their hearts were in the right place, but they got sued, and it cost them $10 million. And now the city of Newport Beach is going around being vigilant, telling cities, don't do what we did. Even though you're very well intentioned, you can very well get sued. So we continue to educate cities. Cities do continue to be proactive, like the City of San Clemente was recently highlighted. But it's imperative that there should be a legislative solution. Cities should not be the guinea pig on this issue. Very encouraging to hear Congressman Issa taking action at the federal level. We have been supportive in the past on federal bills, so I envision us taking a look at this, hopefully supporting it, and if we do, collaborating with the congressman staff to get the word out here in Orange County and statewide. Thank you for the opportunity to speak.
Thank you, Tony. Jackie Salpaddle, Resident Service Program Manager with Interfaith Community Services in the San Diego County.
Hello, everyone. I've never quite been on the political side of sober living. I do work for an agency that does have sober livings. What I want to say is that community is always important to interfaith. Like if we're going to open a facility, a sober living, whatever it is, we go to every single neighbor and we tell them what's going on and we ask their opinions and we make sure that it's okay with the city and more importantly the neighbors, because yes, this is a very important step for recovering addicts and alcoholics, the sober living portion of it, but also the community is as important. And that's what I've been taught at Interfaith, and that's basically how we run our business, and it's not for profit, it's non-profit, and...
Just move the mic up.
Can you hear me now? So that's how I was taught. We're non-profit. We are I'm not here to defend sober livings, especially because I apologize for anybody that's had a bad experience in their neighborhoods or whatever. We definitely go and the community, and in all of our mission statements, it's in our vision, and everything it's all about the community. Because as these individuals go through sober living and are successful, yes, there are a large number of addicts or alcoholics that don't make it, but the ones that do, they are productive members of society, and it helps the community. It's less money, it's less costing to the communities and everything. So I think that it's really important that everybody know that it can be done right, and it doesn't have to be the way that it is, that it sounds that I'm hearing. It's a money thing for sure. It's very clear. I have had experience with sober living owners that are in it straight for the money, and it sounds very familiar to this. I am from San Diego County. It's happening there also. So it's not, it is definitely statewide. And I think the most important thing is that it doesn't have to be this way, and I think that with the policies that are trying to be passed and that kind of thing, it will change. But also, like I said, the individual that's in a sober living, this is such an important step for them. And when they're successful, I don't even think we have a sober living that has 6 people in it. I think there's 4 or 3, and they're successful, and there's a staff member in that sober living 24/7 making sure that everything's good to go. So, I don't know what is happening as far as these people that are opening sober livings just for the money or whatever in neighborhoods, and several of them in neighborhoods. I can't even imagine how that looks or feels to you guys. And, but I do know that it can be done right, and it's a very important part of a person's recovery. And, you know, working for Interfaith, and we are actually getting ready to open like a sober living recovery treatment center, and we just went around to every single business, every single neighbor, and we, you know, let them know what was happening, asked their opinion, if, you know, if they had any kind of negative feelings towards it. But we're definitely proactive for the community, because and that's how, you know, with our motives are good. So I think that's why it works out good. The ones that are for profit, their motives aren't right, so it's not going to turn out right. And it's sad. It's really sad, because those of us that have sober livings that are good and that are, you know, that aren't just for the individual but are for the community also, it makes us look bad. And I think it's a vital part of somebody's recovery, and I think it just needs to be, you guys just need to know that I, along with the agency that I work with, we would go with any kind of regulation that passed. It doesn't matter what it is. It doesn't matter what the regulation is, because our motives are right. We would follow the regulation, whatever it is. So, you know, I believe in sober livings, but I don't believe in the way that, you know, that it's being done right now for like all the money and the profit and all that kind of thing. It's just wrong. And I think that, again, I think that it, you know, I know that it can be done right, and it, you know, like with agencies that are following the rules and doing what they're supposed to do and contacting neighbors and thinking of the community along with the individual, will make a big difference. And as a provider and as a program developer, I helped develop the new program and everything. Community was a major part of the development, and I think that's where, you know, where it's lacking. And having a staff member that, you know, in the house at all times and making sure that things are being ran and nobody's being disrespectful to the neighbors. So other than that, I think.
Thank you, Jackie. Deanne Tate, President and CEO of Veterans First.
Good evening. Can you all hear me? Okay, good. When Congressman Issa first talked to me about what we do for sober living for our veterans, he asked me, what is it that we're doing? So I wanted to just kind of outline to you how we run our sober living, and I really feel from the bottom of my heart that all sober living should be run this way. The first thing that happens when a veteran comes to us seeking housing and a sober living, we sit down with them and we ask them, what is your drug of choice? What is your sobriety date? Meaning, how long have you been sober? And what is your plan for staying sober? If the veteran is already in a program and has a sponsor, then we ask them to attend a minimum of one house meeting run by the veterans themselves, at least once a week for house camaraderie, and provide proof of weekly meetings with what we call a court card. It's actually issued by the court, we just copied it. We also ask for the name and phone number of their sponsor, just in case they develop a problem, because they do develop problems. Everything is not all that smooth. These veterans, the veterans with no plans, meet with the house manager, and together they put together a written plan that is reviewed weekly by the house manager. This is to ensure the veteran is following the plan. If the plan is not being followed, the house manager meets with the veteran to discuss the problems and may call in a behavioral health specialist to join the conversation. While our houses are sober living, if a veteran falls off the wagon, they are given the opportunity, we're in North County, so they are given the opportunity to go to Charlie Street, which is a AA-run recovery house that's 24/7 AA meetings, and it's very, very intense. They go there for a week, and then they get a certificate saying they're clean and sober for a week, and we allow them to come back, and they start with a clean record. and they start over. We have found that sometimes it takes several chances to stay sober, but eventually it works. I've been doing this for 22 years. Our agency's been here 45 years, and we have helped tens of thousands of homeless and drug and alcohol veterans get sober. But I want to give you the what's going on next door to us. We're on Broadway Street in Santa Ana. We have old mansions. We have 2 old mansions on Broadway. We never put more than 2 veterans in any bedroom. No, we don't always pay all our bills, but we're sticking to that. Two veterans to a room. But we're able to have 14 in a house because we have 7 bedrooms at one house and 9 bedrooms at the other. But we also have 4 bathrooms in one and 5 in the other. So it's home. It's their home for as long as they want it. But next door to us, unfortunately, is the exact opposite of us. There's no live-in house manager. Our house managers are 24/7. They're veterans so that they can relate to the veteran with veteran issues. The people next door, the house manager comes, or the owner I guess, comes once a week to collect the rent. The house is a mess inside and out with broken windows, boarded up, loud music playing constantly, and from what our residents tell us, it's nothing more than a flop house for druggies. This is the type of sober living that should be shut down as good programs, and there are many. She has one, I have several, are stereotyped from these that are simply there to collect money. If I was saying what I'd like to see in the law, it would be 4 things. They must employ a house manager from at least 6 p.m. to 6 a.m., minimum 7 days a week, because that is where the problems really exist, is 6 p.m. to 6 a.m. Train the house manager in an AA program guidelines to help residents put together a long-term plan for sobriety. And it's really good if your house manager himself has got at least 5 to 10 years of sobriety. Because you don't know how to talk to people if you haven't been there. If you're not a veteran, you can't talk to veterans. If you haven't gone through a drug or alcohol problem, you just don't get it. Third, must have a program in place to ensure meetings are taking place either inside the home or outside meetings. And also work with AA and local mental health association to have a behavioral health specialist available to the house manager. That's it.
Thank you, Jackie. So we've got some questions that were submitted. Before we go to the Q&A period, I want to give it back to Congressman Issa to say a few words, please.
Thank you. First of all, I want to thank the panel. I really appreciate all your comments. It's no accident that the last 2 panelists have real experience running facilities that they believe strongly are the right way to run facilities. And that doesn't mean that you're going to want one next to you. Okay, you may not like their facilities if it was in your neighborhood, but we opened this up from the get-go. My staff reached out to sober living, if you will, principals, and said, if you'd like to be on this panel, you're welcome to be so. We did not open it up to people on behalf of them. We said we want the principal, because the experience has been, if you're like these 2 folks and you believe in what you're doing, come on up and tell us. We will leave the record open so that anyone who runs a facility and wants to get into specifics about how they run their facility, why regulation could be or should be changed or should be not changed, we want that. We want your input. This is not about writing a piece of federal legislation that is any bit wider than it needs to be to empower a reasonable care for the people that we are concerned about, which, let's remember, a lot of people will say, I don't want this person in my backyard. The one thing I know is that person is going to be in somebody's backyard. And we have to care for them. We have to find ways to make it work. So this is not about, if you will, the opportunist who may be making a lot of money on the back of needy people. It's about the needy people that we want to make sure are finding their ways to solutions. And
Very good.
and I mean this because I certainly I'll tell you just a quick story. All of you here in South Orange County are not surprised that we are a marine town and we think a great deal of Camp Pendleton. But I'll tell you, if you're the congressman, every time the artillery training goes on, you get a call from people who think you should stop it. It's my job not to listen to those people. And the same is true. We are not going to work on federal legislation purely to empower people who don't want it in their backyard. But we do want to make sure that many of the horror stories that we have seen, not just in South Orange County and North San Diego, but I have colleagues that are working with me on both parties. They come from every other state practically. We had a gentleman out here from Ohio. He's a former mayor. He's concerned about it. We have a number of Floridians of both parties that are seeing the same thing. Now, Ohio is less of a destination than California or Florida. This will not surprise you. So I want to make that clear. The second thing is the draft legislation that we're talking about. There are always going to be language changes and changes again. We put out the draft legislation so people could understand that we want to make it narrow. We want to make it limited so that we are not wholesale empowering cities to simply create no-go zones. So the one principle that's in the bill, and I'll quit after this, the one principle that's in the bill is cities cannot use their zoning capability to stop these facilities altogether. Every city, every county has to carry their fair share of a burden of alcohol and drug addiction. And that's only reasonable. We can't say, well, they may get drunk in my neighborhood, they may get stoned in my neighborhood, but we don't want them living in our neighborhood while they're recovering. We need to be balanced. So I say all of this because I'm going to be your advocate to get this done in Washington. But I'm also going to be the advocate for the fact that millions of people need care. And we want to have as many examples of how it could be done while not being unfair to, if you will, communities. So thank you. I'd love the question.
So we have quite a few questions. We're going to start the process. I probably won't be able to get to all the questions, but the questions or statements that were submitted will be given to Congressman Issa's staff, so they'll be reviewing it and reaching out as appropriate. We're going to probably have a hard stop at 8:30, so we're going to allow about 30 minutes for Q&A. So with that, I got a really good question to start off with that might be best for the attorneys and for Jackie and Deanne. What is the difference between residential treatment and sober living?
For me?
Either one, whoever wants to get to the mic first.
So residential treatment is very structured. It's groups, it's life skills, it's a licensed facility that is providing counseling, therapy, very structured 24/7 treatment. I mean, it's focused. Sober living is the step after treatment. You don't have groups and all that kind of stuff. It's the step after treatment. It's right prior to being out in the world on your own, in your own apartment or your own home or whatever. So sober living is the step after treatment. It's not treatment, it's like aftercare kind of.
Most residential facilities that I know of, residential treatment centers, are drug and alcohol licensed by the state of California versus just being licensed by your city or whoever.
If I might chime in as well, this kind of goes back to that discussion about non-medical services and how that can be viewed differently depending on whether you're a profit-motivated operator or a community government. The legal distinction between a residential care facility, the statute has a really long name. It's like alcoholism or other drug treatment or recovery facility. It's really long, right? So we just call them residential care facilities. If you're offering any non-medical service, you have to get that license. A sober living home is not defined by state law, but state law does mention a recovery house, which it says it's essentially a sober living home, and it defines it as no care or supervision. No care or supervision. So you can see that it's not defined technically, but no care or supervision versus any non-medical service. And that's the real distinction. I think there's a little muddy room in there, which I can't say enough about how grateful I am that you two came, because what you're doing sounds like a great model, and it takes courage to come to a setting like this and talk about that. But there's some landlord kind of supervision that I think is built in and reasonable, that the statute's not trying to exclude, but it's when you start to supervise them in their recovery that it starts to feel a lot more like a non-medical service that requires the state license. And again, it goes back to that policy concern. We don't want people to be running the lives of people in recovery if they're not licensed and supervised themselves.
Okay, next question, and this might be for our state and federal level. Why isn't the government doing anything about the fraud in the rehab industry, even when companies have been absolutely identified and it continues without penalty or responsibility?
Okay, I guess I'm hearing we're not doing anything at the state level.
We're not engaged, like,
I'll give you something that has not happened yet, but that likely will happen. The Federal Trade Commission has an unfair trade practice capability, and they can and could at any time begin investigating any actor in this business. And from a personal standpoint and from a professional standpoint, having worked with the FTC, it's my view that we need to have some of these legal changes, but this will not stop bad actors alone, and we can and should ultimately look at the worst of the actors and ask the question of, are they deceptive in their practices? And this might not be as likely to be organizations that are simply taking government money, whether it's the Affordable Care Act or other treasure troves of money. But when you look at people on the other end of the country who often, based on an internet or referral ad, are sending their children across country, and they think, and it has been implied, that their children are going to be sober when they come home, and they find out that they're pushed out the door whenever they run out of money, and that in fact there is no treatment. Those are classic examples of crossing state lines under a deceptive purpose, obviously implying a service that is not rendered, and if it is rendered, it is not rendered sufficient based on the advertising. So there is a federal role, but to be candid, as a legislator, I'm also seeing that there needs to be some empowerment of state and local. By the way, I want everyone to understand, I have low expectation for every state to immediately say, now I have the tools, I'm going to use it. This will likely be a federal change, which then some states will adopt. They will in fact show that they can help with this problem. Other states will then see people flocking to their states because they haven't dealt with it, and you will get a ripple effect of states eventually fairly uniformly dealing with the problem. So I've been at the federal level a long time. I believe in the federal system, which is we don't run everything, and the less we run, the better off it is to let the states run it. Right now, the states are being prohibited from running it.
I'd just like to add, because I shouldn't say the state isn't doing anything, if there are allegations of fraudulent receipt of Medi-Cal benefits for these individuals, then certainly the state steps in there. Regarding the licensing of the licensed homes, the Department of Health Care Services in the state is kind of overwhelmed with the kind of complaints we have here tonight. But having investigations, let's say in a facility that's unlicensed, maybe giving those non-medical services, and we know that people are being harmed, when you turn those complaints in to the Department of Health Care Services, the enforcement of that is very difficult because it's so widespread. In my own neighborhood, we turned in a situation where a young lady was found at midnight on the curb. I have one right around my house. She was crying. She told us that her goods, clothing, all of her things had been held. She was held captive. She had to get out of the house. They wouldn't release her belongings, and then she had a friend pick her up. So we needed her to testify, and we could no longer find her. The problem is that people do, when they have these problems, they go undercover, and you have to have evidence to even pursue. So the enforcement regarding treatment in these homes and whether they are violating, you know, perhaps their license or unlicensed, very difficult. But the Medi-Cal fraud, that's where we need more reporting, where doctors see when these bills are sent in, or when they go to our Medi-Cal billing in the state, that they really start checking that out. That's something that we pursued initially, and we need to ramp that up for sure. And that was one of the bills, if I remember correctly, Bill, that we tried to get a registry that the courts would refer people to when they needed the sober living treatment or non-medical services on a sobriety plan, and that particular piece of legislation was killed. And we felt that was really a good one, because then you would know, people would register that they're renting these very good homes, and they would have a registry at the courts and could be referred to those. But we didn't make it across the finish line with that either, and I believe that's one that will be taken up again this year, because as more information comes forward, as there's more community input, and certainly letters and emails to your legislators, and certainly to the Department of Healthcare Services, they start to see, guess what? There's a real problem, and we need to be part of the solution. So that's where we need your help, to keep the information coming, and then the education, and certainly in enforcement will ramp up, and we'll get the good actors, and certainly hope we corral the bad actors and get them out of the business. And I will share one more thing. In my neighborhood, there is an operator, I don't know if he's here this evening, he put on the multiple listings a home that he runs in my neighborhood. He said on the multiple listings, he has another one in Laguna Beach, and he has another one in Dana Point. He is selling them as a package, as a wonderful business for $16 million. And the gross that he is promising to the buyer is $14 million annually. So those are the kinds of things that we need something that kind of reins in on that, because that doesn't suggest to me that the person that purchases that is really going to be in the business of helping that person, unless they are a distant operator, but they then get very qualified case managers, house managers to run those particular homes. So those are the things we deal with.
You didn't answer the question.
Oh, sorry.
The question was, where are the 8,400 people in this community supposed to seek treatment within this community?
I can tell you right now. I can tell you exactly where they should go. I don't know that this is a Q&A right now.
But it was my question.
It was a prepared question and you submitted it, so let it go. But the answer is, it should go 8,400 or however many people. They can always go to a state licensed facility that has a capacity of 6 or fewer, because they can go into any neighborhood in any number of facilities. That's what state law says. You want to know where people can go? If there's demand, we can have innumerable state licensed facilities for 6 and fewer. It's a simple answer.
No, it is not.
It's not, we might not like it.
Your neighborhood, or your neighborhood, or your neighborhood.
I'm just saying that's what state law says, that's where they can go.
You know what, they can go to AA.
I'm going to offer, please keep decorum and be professional while we go through this.
One of the reasons we took everyone's questions is so that if we can't answer them all here tonight, we're trying to take as many as possible. We'll be able to follow up with everybody, and that's our intention. And many of you did give us email addresses and the like. You know, this is a good question, and I appreciate your question. I think one of the first things we have to realize is the 8,400, many of them we treated in their own home with their own spouse. They'll continue living at home. They're not all going to necessarily be on the street. Having said that, it's a good question, because we do have to find ways to care about the person that we're talking about here tonight, the 8,400 individual people. So that's one of the reasons that nowhere in the draft federal legislation are we planning to allow communities to simply say, if you object, it can't be in your backyard. The answer of these homes at 6 that are in fact simply living within the spirit of a neighborhood that in no other way violates the neighborhood. 6 is not a lot of people for most of the homes we're talking about. The fact is, we recognize that that's now. There are going to be larger facilities The fact is that, we realize that there's a need, and there's not enough of it. But it's clear that there's plenty of money to pay, and this is my point, I guess, is there's plenty of money to pay for good facilities. There isn't a need to have somebody selling, as Pat Bates has said, a business for millions and millions of dollars because it's raking in so much money. If people want to provide this service, and I know there are many who do, we want to make sure that that's facilitated. And that's why, from a federal standpoint, I want to make sure that there are reasonable opportunities. Now, I will go to with, Senator Bates's one point. The U.S. Census and the federal government and this state all should have an interest in knowing about group homes. Not everyone knowing where yours are, but it's like anything else. If I have sprinklers in my home or I don't have sprinklers in my home, the fire department has a record of that. That's good management that cities require. The reality is that we should know that the City of San Clemente should be able to say, we have 8,400 beds in this community because they're listed somewhere, not necessarily open to the public, but listed. And that's one of the things I think that when we have representatives that are trying to deal with this on a state basis, hopefully they'll get cooperation. I spoke to the Democratic floor leader of the Senate, who I've known for many years, and asked him, isn't there some things that you would like to see get through committee? And he said he was going to watch this hearing, he was going to take a personal interest in it. We've been friends for a lot of years. But the reality is, this state has not done many of the things they should because they have a fear of NIMBYism. One of the things I want to make sure we're doing here tonight is, and for some of you that may be a disappointment, but I'm not going to guarantee you won't have a home with 6 people moving in next to you. I'm not going to guarantee you that. I don't think anyone should. We do have, if you will, I'll use your number, the 8,400 just in this area that need to have care, and the number may be higher. So there is a need to balance. What I think we're dealing with here tonight, and I want to get quickly to the rest of the questions, is we want to understand what the right balance is to protect, and in my legislation, it says, A, is necessary to preserve the residential character of the zoned area. If you have a seniors-only home, senior-only home, and people have signed on to CC&Rs for that neighborhood, then if that's the character, then they can't be old people, young people wanting to get into sober living. That just makes sense. And we want to make sure that, and I want to encourage everyone to look at it and make comments to the legislation. Because this legislation, I'm confident, will move. It's bipartisan, and we want it to be right. Thank you.
Thank you.
If I may weigh in really quickly from a local level. See, we're a community of around 64,000 people. Approximately 1 in 10 of us is addicted to something. And only about 11 to 12% of those folks at any one time are seeking treatment. That puts us at approximately 650 people locally who are seeking treatment at a given time. I don't think any San Clementian has ever begrudged folks who need help and offered to help. The problem isn't necessarily that our residents are having problems, is that we happen to be a singular location for the entire country to ship their addicts to our and it's so great here, no one wants to go back. And that's the problem. That's the problem. So all we're asking is that we can take care of our own, just don't make us watch everyone else's problems too.
Okay. Next question. One of my concerns is the lack of knowledge that the neighbors have about the ever-rotating group of residents in a sober living home. What if they are a registered sex offender? Under Megan's Act, I can search for sex offenders in my area, but I am unsure that residents are not updating their addresses or in the system for a 4 to 6 week stay. We know nothing about these residents when they are in our neighborhoods. I guess for the attorneys, do you want to cover the sex offender part? And then I would probably ask. Jackie and Deanne on how they deal with that element in their facilities as well.
Boy, I didn't sign up for that.
Maybe we'll just go to the operators and leave the sex offending lawyers out of this. So, I mixed the two. They came out wrong. But no, seriously, it's a very good question. As an operator, how do you screen to try to make sure the public laws are complied with?
We check for two things when any veteran walks in the door. One, the sex offender list, Megan's Law, Jessica's Law, all the laws. And the other thing is they have any outstanding warrants, because we don't want to be shielding anyone that is wanted by the police or anybody. So from my experience, if you are staying someplace 4 to 6 weeks and you are on Megan's list and you have a parole officer, you have to inform them immediately. If you have done with parole and you're done with probation and all that, then you just have to check, because they don't have to check in with anyone. So you just have to go to the list, and the lists are they're pretty up to date.
We don't know who's at the home. We don't have names. We don't know who's at the home.
No. The operators have to check. Well, you know what? You know what you can do? Just tell you what you can do. Because somebody slipped by about 5 years ago, slipped through the cracks of ours, and we got somebody. It wasn't a week before somebody started flyering the neighborhood saying that we had a sex offender. Of course, we got it out immediately that we found out. But you can check yourself. I mean, you can go on the list and
We don't have their names.
no, you can do, you know what, they have these little red dots showing you where they are.
They don't report their address.
They stay for 2 weeks.
I can speak to this a little bit here. We had, I'm sorry, I can speak to this a little bit. It is a challenge, and this is one of the things I think from a federal and from a state level, is we had the same problem. We had a home that had anywhere between a dozen to 16 people in it. And when we tried to do those same searches, the operator was not as responsible as you. Not as responsible as many of the folks who are here tonight trying to do it the right way. They were strictly in it for the profit and were packing the house full, and we had no idea who was there. They would not provide the information. They weren't registering as an official address, and they were there so quickly that it just, they were turning it over very quick. So honestly, this is one of the items that I think that the state bills that we were looking to do in terms of the reporting would address that on point. And that's why we need our state legislators to step up to address this issue first and foremost, to allow us to identify if our neighborhoods are safe. And that's why our good representatives have done good work for us on this. They have done good work. We just need the rest of the political class to help us out. And I know, right? There's always someone else. But there is always somebody else. And in this case, though, but I think that's part of what, from a federal and from state level, we can address that. On a state level, it's really hard for us to control. And the operators, the responsible ones, will do it. But we're not worried about we're worried about the irresponsible ones and how that's going to affect our neighborhood. So it's a really difficult question to answer to satisfaction. I'm sorry. It really takes our elected officials doing what they need to do to get it done.
Tim, my operator next door to me is on probation.
I hate to say this, but the operator that was running our house was one of the ODs. It's a very sad reality that sometimes these homes do not operate correctly, and we are stuck with the bill as a neighborhood. But we can, through good legislation, sort that out and make sure that we have responsible operators, because right now the free market is not taking care of that for us.
And as I mentioned in my opening statement, that's one of the issues. Legislation just to count them and put them on the website, the number in your community, failed. So we have no information on these unlicensed facilities. So if you don't have any information on the facility, you're not going to have any information on the residents of the facility. Now, fortunately, good actors who, go through the records, look for sex offenders, weed out bad actors, you probably have some sources that they're doing the right thing. But that's part of the sober living aspect, is that they are totally unregulated, and we cannot get any information on them.
Jackie, did you want to add anything?
No.
Okay, this is
the spelling of your last name, or can you tilt your name tag sign? Thank you.
This is a question for the Congressman. In your proposed legislation, can you clearly define a home occupied by 6 or fewer residents, all in a lease agreement, from those for-profit transient boarding houses that are ruining our neighborhoods? Also, can you require that whoever owns the property must provide proof of current insurance for the intended use of the property.
Well, insurance is a state issue, so for a moment, I'm just going to leave that off the table. It's not likely to be something that would occur in federal legislation. Additionally, candidly, we have certain views of limitation. This 6 is one that we can put into legislation potentially to maintain an exemption. What I want to make sure people understand is what we hope to achieve with this, sans, let's say, if you will, small facilities, the 6 that we talked about, is if a city chooses to regulate boarding houses, there isn't a problem in the world. I've got city people up here. If they want to regulate boarding houses, not sober living, but boarding houses, they're already doing it. If they want to have something zoned R1, they do it. If they want to collect TOT, tax on tourism, from both hotels and boarding houses, they could do it. So one of the challenges we have is that most of this problem that the question begs isn't a problem. As long as someone's not standing behind a disability claim, there isn't even a federal question. And that's one of our challenges is we are dealing with a set of good-meaning, well-meaning federal laws that people are standing behind and saying, well, you can't touch me because I'm dealing with disabled people on their behalf and you're discriminating. We want to make sure that we narrowly eliminate that exemption that people are standing behind. If somebody wants to have a boarding house in a R1 neighborhood with 25 people in it, whether they're staying for one night or 1 year, cities can and should be able to prevent that. We want to make sure that to the extent that somebody is, if you will, abusing a character of a neighborhood with 20 people in a place with 2 bedrooms and 1 bath, that we can let them do it. So again, the legislation is draft, but we want to make sure that it's narrow because we know we want to, on behalf of people who are getting qualified residency and are seeking and achieving treatment or coming out of treatment, we want to make sure that they're not unfairly disenfranchised. The laws are there to protect them. We want to make sure they protect them. So again, I appreciate that people look at this and say it doesn't do enough, or what about boarding houses? The reality is your federal government's not going to come in and deal with boarding houses. Your city can do it and should be doing it.
Thank you. This probably is geared toward our electeds. Where do you, and it's a little bit of a redundancy, but it has some other nuances to it. Where do the people in our community expect recovering people to live, as most need at least 1 year or more of supported transitional sober living support? Hospital and treatment insurance covers not more than a month. So where would these individuals go to live for recovery? Do you realize that 10% of San Clemente residents need substance abuse services?
I'll try and answer this best I can. I'll look back to my previous comments. The fact is there are 10% of our community that does have an addiction problem, but only 11% of those at any given time are seeking treatment. And we haven't forbidden the use, or excuse me, we haven't forbidden that these facilities can exist, but we have shaped where it can exist. And so it's not as if we've eradicated the usage altogether, right? That we've done it. We have taken, as Congressman I said, our fair share, and we've placed zoning maps where those will be allowed going forward. But again, I come back to the fact is that most of the residents here, when I chat with folks in the community, it's not that they begrudge local residents seeking treatment, looking for places to live. It's when you meet the newly arrived homeless person on the street who happen to be from Ohio, or from Michigan, or from Florida, and they like it here and they're not going to go back, and so they're figuring out a way to stay. Those are the things that are hard for us to take, because ultimately...
Even if he's a veteran?
Well, listen, here's one of the challenges, that facilities like that exist, and responsible ones will never let them get on the street and always provide care that they need. It's the irresponsible ones that are really the ones that are hurting the entire group.
You know
and
the
so,
numbers they're on the street, they're
I know, I won't do a Q of A. I won't do a Q of A on this.
That person left on a gurney.
No, he didn't. Actually, he said he was happy that no one left on a gurney. You may have misheard it.
All I'm saying, to be extremely clear, is that no one is saying that our local residents don't need treatment. What I am saying is that we shouldn't have to bear the burden for the rest of the country because we're a nice place to live. That's all I'm saying.
I think part of the point that's missed here when you kind of repeat that question, because I hear what you're saying, we have people in desperate need of these facilities. And all of us, in fact, me, because there's one around the corner, no problem whatever with that facility until things started happening to the people in the facility. Coming out, sitting on the street, crying, saying they were captive, and then disappearing. The community facility right next door with the swimming pool, kids in there shooting up from that home. So those are the things that start to bother us a little bit, that they are not getting the treatment. They can be 3 on my street if they are all getting the treatment they need.
Senator, I have to ask you this. You witnessed them shooting up and you did nothing?
No, they called the police, but because of Prop 47, you are not a felon if you're in possession. It's only if you're selling. So there are other laws, state laws that are on top of that, that continue to get in the way of enforcement to ensure those living in our communities are getting the treatment they need, and they are going to be on the road to recovery, and they are not changing the character of those neighborhoods. That's what this is all about. It's not where are they going to live. Fine, live among us, but live in a way that you're going to have a path to recovery, and we'll be able to cheer you as you move on and find your own home. That's not happening in the multitudes that are there.
Let me say a few words about the veterans. I'm a veteran, and I had the opportunity to be appointed by President George W. Bush to the Department of Veterans Affairs. And one of the first things I did is I went into Washington with a person from the hospital. We went through the soup kitchens, we went through the parks, and we just started asking people, anybody a veteran, anybody a veteran, anybody a veteran. The issue with the VA is they have so many programs, every program a veteran could ask for. Drug and alcohol, job training, housing, everything. You can't physically take someone and make them do it. That's the thing that was ingrained in me, and the numbers were 25% of homeless are veterans. You can't physically make somebody go take those programs, although they're available. We just need to educate them, and if you happen, we took a couple of people in who were very ill to the VA Medical Center, and happy we could do that, but the rest of them, we just need to let them know the services are out there and try to get them to take advantage of it. How we house some of them, the private sector, if there's a demand, will come in. I happen to know, because I represent Aliso Viejo, and so does Senator Bates, that a private sector company is coming in and building a 73-bed hospital in Aliso Viejo. And that's the model I would like to see. A holistic 24-hour approach where people can get the care they need from medical care. And finally, the issue that our bill tried to address, the Bloom-Bro bill, and Congressman Issa mentioned this, it's the over-concentration of them. And Costa Mesa has this firsthand. Costa Mesa has 3% of the county population and 27% of the sober living homes. So as Tim said, Costa Mesa is, they can take care of the folks in Costa Mesa who need help, but they are taking care of people from all over the country, and it's an over-concentration of them in one community that ends up disrupting the community.
Okay, let's see if we can get through a few more questions.
Okay.
If you want to take a couple that are similar and sort of read them together, that'd be fine too.
Okay, so we have 2 actually that are like that. So regarding your proposed legislation, isn't this exactly why the Fair Housing Act was created? To protect against these zoning/regulations from discriminating? And then the second part to the question is, who gets to define the residential character of a community where 10% of the residents have untreated substance abuse problems?
That's a great question, and the second half of it is a particularly good one. We are aware in this placekeeper on the residential, the character of the community, that it's going to have to be clearly defined and limited. We're not expecting it to be a broad brush of, I like my community because nobody here has problems. That's not acceptable. So we have to realize that we all have drug addiction in our communities, and we all have children with problems. We all have all of these things, and we can't assume that's not part of the character of the community. when we go back to the intent of these federal laws, they intended, and the attorneys did a good job of explaining, they intended to eliminate discrimination against people who would be discriminated against. They did not intend to have a broad brush that applied to everybody. In other words, I've zoned R1, I do not want to have 30 people living in a 2-bathroom house. That is not a discrimination against people who are disabled. As a matter of fact, if you look at it logically, if somebody says nobody could live there unless they claim disability under those conditions, then it's a preference group. We did not intend the disabled to be preference group. We did mandate in the law that in public, in all public access places, there be reasonable accommodation. So the reasonable accommodation is that these people with disabilities shall have reasonable accommodation to be in these neighborhoods, not to completely change a set of base laws that exist for everybody. And that's one of the challenges we're facing, is we want to make sure that in no case does somebody use any law we have to create discrimination. And we will write it on a bipartisan basis with lots of Republicans and lots of Democrats from around the country wanting to preserve that. And I make that point because we're forming a coalition of people who see problems, all of whom do not necessarily share my views, but most of whom do, that we have to be very careful. We do not want to create a loophole to be unfair to any group, including people trying to get sober. So I think it's important that we understand we're coming in with federal relief. Now, when it comes to the abusers, earlier I talked about using the force of the federal government, the FBI, the Federal Trade Commission, and other agencies in combination with the state, because we do need to look at some of these bad actors as simply bad actors, and in some cases they're crossing lines of their unfair trade practices and so on. We can do that too. So there's a two-step, and we're not going to take care of everyone based on it. Now, I happen to also think that somebody who has marijuana sold in the front of their house, you know what? If you're actually doing that, there's a federal law that allows that home to be seized and sold off as a place being held, and if you rent to people, you take some responsibility. So there are situations there that I think we need to look at. Really bad actors, bad locations. Let's see if we can't use some of these laws. And by the way, those laws are both state and federal. Any law enforcement can bring using the federal law and actually get that seizure. So there's a lot of tools. What we do see is there's also an epidemic of bad actors over and above the epidemic of drug abuse. Let's not forget the epidemic of drug abuse is there too.
Okay, 2 more questions and we'll come to an end.
Eric, can I just quickly add to that last? When it comes to, isn't that what the FHA is supposed to protect against, is that? The FHA is supposed to make sure that everybody in these protected classes has an equal opportunity to use and enjoy a dwelling. That's the intent. That these individuals have an equal opportunity to use and enjoy a dwelling. That means that if me and Peter are each trying to rent the same house, and the landlord says yes to him and no to me because of my race or my religion or my disabled status, that violates the FHA. Now, if Peter and I are both trying to go rent a house, and I'm disabled, should I get to rent that house and turn it into a hotel? No. I don't get to turn it into a hotel or a boarding house or anything else that's not allowed there as a use. We're not the FHA isn't supposed to be a free pass card or a total exemption from local zoning. It never was supposed to do that. It was supposed to make sure that people could go and rent or buy a house or an apartment to live in, that they would have equal opportunity to use and enjoy a dwelling. That's it.
So we'll do 2 more questions. If the ADA is the guiding legislation, why aren't the facilities required to be ADA compliant in terms of handicap access, bathroom size, handrail requirements, etc., regardless of the number of occupants?
You know, that's an excellent question. And the short answer I've been given when I looked into it was, if somebody wants to live in that residence and they're in a wheelchair or in some other way handicapped by a different disability, and that operator chose to say, well, I'm sorry, but I can't have you because I can't do that, that there would be a great lawsuit. You know, one of the challenges is you need an injured party, and homes are not ordinarily required to facilitate for everybody. Commercial structures are, and this is one of the basic problems, is these are residential homes in many cases being used like a hotel. And the question begs the question of, should a city be able to define a place that's operating at that level under its zoning the way it would define in a hotel? And that's one of the areas that we want to look at, is if 6, and we always use that number, if 6 doesn't cross the line, we're not going to have that discussion. If 14 does cross a line, and we need to empower cities to be able to say, you know what, you got to get a commercial license if you're going to have 14 or 16 or 20 people in a single family home, and our zoning may limit your ability to have that glorified boarding house. So this is one of the challenges. It's a great question. Again, one of the reasons that we have a panel with state representatives is that this will not be answered in only one capital. It will be answered in the 2 combined plus cities.
Thank you. So our last question for the night, and I apologize if I didn't get to your question again. We'll be giving them to Congressman Issa's staff.
And both state senators.
And both state senators as well. Why not let the state decide instead of the top down? Federal rules and follow the Constitution. Please explain what part of the Constitution provides for the federal laws like this.
You know, this is the last question that I'm going to break with protocol. Who asked that? Because I want to ask a follow-up question to understand it.
I did. Your Constitution is limited, limits federal power. But you guys make it as wide as possible.
Yeah.
And that's a federal law now, the ADA, that's causing this problem in our state.
It's a good question. I understand it. We have passed those laws. The Americans with Disability Act was before I came to Congress, as were the others. What we're looking to do is to narrowly limit the unintended consequences, the overly broad. You have a good point, which is we do have a great many laws on the books in Washington that our founding fathers would be horrified to find out.
Including the ADA.
Well, anti-discrimination laws, I think, are actually very consistent with the Constitution. The Constitution intended that including people who owned slaves, intended to be better than the actions of their time. And I think that's the important thing. The Constitution as a document, and including its amendments, I think do cover anti-discrimination and the need for the federal government to weigh in. Brown versus Board of Education was a great example. We brought in federal troops to enforce the federal court's decision about discrimination. We're not trying to unring that. I know there are a lot of things in Washington you don't like. I don't consider the Americans with Disability Act per se a bad act. I know that there are unintended consequences. This is the reason that you pay us year after year after year, is we have to both deal with changing times and we have to deal with the unintended effects over time of laws we pass. This was not a problem, as they said in the opening, this was not a problem until a money source began to appear that created opportunism well beyond some of the nonprofits and other groups that existed. And one of the things, and we have a lot of groups here, and I'd ask all the people who are operating in the sober space, stay in touch with our office, because we want your input on what can be done, should be done, what the best practices are. And by the way, they don't have to all be the same. You know, our view is we're not regulating how you do it. We just want to give the cities limited authority against really bad actors. And that's my close for tonight. I want to thank all of you for being here. We're going to stay involved in this, and hopefully we both satisfy the community that we're working on it together, and those who want to do a good job for people with real disabilities. We want to make sure that we do allow that to happen, that these communities do have places for people to get and stay sober. So thank you.
you, Congressman Issa. Please give the panel a warm round of applause, and thank you.